Hey everyone, Certified Lymphedema Therapist here. Let's go step by step through a lymphatic drainage routine to help move fluid for breast and chest swelling and lymphedema. If you want printable handouts, check out the links in the description box down below. So we're going to dive right in, but if you have any new symptoms or pain, always check in with your doctor for clearance for safety. It's also best to do this routine directly on the skin if you're able to, and this is something that can be done daily. So first, let's start with 4 deep breaths to stimulate the deeper lymphatic structures. Gently put your hand on your belly, pressing inward. Take a nice big deep breath in, feel your belly expand, and then let your breath go. And we're going to repeat that 3 more times. Take a nice big deep breath in, and then let your breath go. Repeat this 2 more times. This will increase flow of the lymphatic fluid through the large vessels in your chest and your trunk area. Next, we're going to stimulate the lymph nodes that are right around the collarbone or clavicle, as all of the fluid in the body goes to these areas before moving back to the heart. So doing 8 to 10 circles on either side, right at the base of the neck. Next, we want to stimulate the lymph nodes that are right below the ears on either side of your neck. So putting your hand right on the outside of your jaw, and doing 8 to 10 circles on both sides, right below your ears. Then we want to stimulate the lymph nodes that are in the armpit. So taking your hand, putting it directly in the armpit, doing 8 to 10 circles in either direction on one side. And then you can go ahead and repeat the same thing on the opposite side. Hand in the armpit and doing 8 to 10 circles. This will stimulate the lymph nodes that all of the fluid in the chest and the breast area go towards. Lastly, we want to stimulate the lymph nodes that are right at the groin area. So right up where the sitting crease is. Again, directly on the skin if able, doing 8 to 10 circles in either direction. So then we want to look at the side that someone has swelling. So I'll be working on my left side, but do this on whatever side you might have swelling on. Start to move fluid down the side of the body from around the armpit area down towards the groin. Go and doing 5 to 10 strokes down. This part might not be needed for many individuals who don't have significant swelling, but if someone has the time, doing a few strokes is great to add. Then we want to think about taking the chest or breast into 3 sections, upper, middle, and lower. Starting with the upper, we're going to start to move the fluid away from the swollen side towards the healthy or non-swollen side. If someone has swelling in both, you may just stay on one side and that's okay. We're guiding the fluid 5 to 10 strokes across the upper chest from one armpit towards the other. Your pressure should remain nice and light and again directly on the skin. Then we're going to start to move from the middle. So we want to think about starting from the middle of the chest or breast area and moving across towards the opposite side. At minimum, we want to make sure that we're crossing midline or across the sternum area so the fluid can move across towards the lymphatic system on the opposite side. Spending more time in an area as needed if you have more fluid on the inner breast or chest. Thinking about guiding the fluid out of that area and then also working underneath the breast or the chest area, guiding the fluid across midline towards the opposite side. Then from the outer part of the breast or chest, we're going to guide that fluid out towards the same side. This reduces the amount of tissue that the fluid needs to move through. This is also the natural direction that the fluid likes to move towards within the lymphatic system. So guiding the fluid, especially in any area that you may have more swelling, out towards the sides. You'll spend more time in an area that is troublesome, that has more fluid. From there, if someone has a lot of swelling or severe swelling, we may start to work that fluid down the side of the body towards the lymph nodes in the groin. Whereas some others who maybe have mild, maybe moderate swelling at most, that fluid may stay towards the armpit, and that's okay. But if someone has extra time, it's okay to start to guide the fluid downwards. What we're learning with research is that a lot of the fluid stays going towards the armpit even if someone had lymph nodes removed. And so working the fluid around that armpit area, stimulate it, get it moving, is going to be really beneficial to make sure that we're clearing out any fluid and congestion. We can go back to any areas that you may want to repeat, guiding the fluid away from that side towards the healthy side, or even guiding it towards the collarbone or clavicle area. And you can finish moving down the side of the body, again, if you have more time or you have severe swelling. 5 to 10 strokes is enough, or spending as much time as someone may need. If someone has fluid that wraps around towards the back and can't reach, it may be worth getting assistance from another individual to help with that fluid as well. Then I like to go back and re-stimulate the lymph nodes that we've worked towards by doing 8 to 10 circles on either side in the armpit area, as well as down into the groin. And then finishing right around the collarbone or clavicle. And then finally with a few more deep breaths. Putting the hand on the belly, taking a nice big deep breath in and out. And again. The deep breaths will help re-stimulate the deeper structures and lymphatics, making sure that all the fluid in the body continues to move. And that's a full sequence for lymphatic drainage to the breast or chest area for lymphedema or swelling. Again, to be sure to reach out to your doctor or certified lymphedema therapist for more personalized guidance. I hope you all found this video helpful, and we'll see you all in the next one. Thanks, everyone.